Hi guys, so we're going to have a little chat about the devices, the components that come with all the different Bio devices. Now, for those of you that have just started using the Bio range and those that have been using them for ages, you'll recognise that all the devices, apart from the BioSoft, come with this nice little packet of components. And we get asked lots of questions about these. What do I do with them? Do you take them back? Can I recycle them? I would say keep them. So in my clinic, I've kept all the different components that I don't use, and what I find is that I do end up using them on other devices. So what we're going to talk through is what we use each one for, because we do get lots of questions about this. So some of the packs vary slightly, so some have got 4-foot posts in and some haven't, but we'll go through all of them. So for the rear foot, we've got 2 degree, 4 degree and 6 degree rear foot posts. So they, and I'll just show you here, they're all adhesive backed, and you just pop them on the back there just like that, and they come off pretty easily as well if you need to take them off, but if you stick them down pretty firmly they'll stay. Now we call them rear foot posts. You could stick them medially or laterally depending on what you want to do. Most patients tend to excessively pronate, so most of the time we'll put these on so that the thicker bit is on the medial side, but there might be the odd occasion where, I don't know, you've got someone who's a supinating foot type or they're laterally unstable and you might want to put it the other way around, but you've got the versatility to do that. So 2, 4 and 6 degree, it does say that on there, so have a little look on the side. But I think out of years of using Bios, these are probably the components that I use the most of. And then on the other side here we've got some 4-foot wedges, and these can be put medially and laterally as well. So again, you just take the adhesive back off, and then you'll see I've got a Bio Advanced here that I'll show you on, but most of the devices have got a little imprint there and it shows you where you can add that on. So this one shows it laterally, and the reason it does that is because that helps engage the windlass mechanism, but you don't have to put it on that way. You could, if you wanted to, put it on medially. It's up to you, and it depends what the patient's coming in with, what you're trying to achieve and what forces you're trying to unload. So that's your 4-foot posts, and they come in a 4 degree angle on there. Then we've got our rear foot posts, so they're 5mm, and that's just a heel lift. That's just giving a heel lift to the back, so it's not angling it one side or the other. We're not putting it medially or laterally. That is just literally lifting at the back. So if you've got somebody with maybe tight gastrosoleus complex at the back, or they've got acute Achilles problems, then that's when you might want a rear foot heel lift on there. And then finally, and these are probably the ones that I use the least of, but I know other clinicians that use them quite a lot, these are just some heel cushions, and you can just stick that on, and basically what that does is it gives some cushioning and some shock attenuation as you get heel strike on there. So you don't have to put the same ones on each device. You can you know, mix them up a little bit, but I would definitely advise you to keep hold of all of these because they do come in useful for patients further on down the line. And also they're free. They come free with most of the devices apart from the BioSoft, so keep them, use them, and have a play around with them as well. Sometimes I find I end up using things like the heel cushion there. Sometimes I'll use that underneath the 4-foot as a little bit of a met support underneath there. So the more you use it, the more things you'll find that you can use them for.